Diarrhea is a common gastrointestinal symptom characterized by loose, watery stools that occur more frequently than usual. That's the simple definition. So, while it's often a short lived and relatively benign condition, there are some causes of diarrhea that can be more alarming and potentially dangerous. So, in this video, I'm going to talk about the 10 scariest causes of diarrhea, highlighting the importance of seeking medical attention when necessary. All right, the first one up is cholera, which is an acute diarrheal illness caused by the bacterium known as Vibrio cholerae. It's contracted by consuming contaminated food or water, and it can cause severe dehydration and even death if it's left untreated. So cholera is a significant concern in developing countries with poor sanitation and limited access to clean water. The symptoms include a rapid onset of severe watery diarrhea, vomiting, muscle cramps, and dehydration. Prompt medical attention and rehydration with IV fluids are crucial for treating cholera. E. coli, Escherichia coli, is a type of bacteria that can cause severe foodborne illnesses. While many strains of E. coli are harmless, some can cause diarrhea, abdominal pain, and vomiting. The most dangerous strain, which I actually first learned before med school when I was watching an episode of Forensic Files, was E. coli 0157H7. And that can produce a toxin called shigatoxin, which can lead to a life-threatening complication known as hemolytic uremic syndrome, or HUS. So HUS can cause kidney failure and can cause low platelets in the blood and other complications such as neurological defects. Salmonella is another type of bacteria that can cause a foodborne illness. It's often contracted through consuming contaminated food, such as undercooked poultry, eggs, or unpasteurized milk. Symptoms of salmonella infection include diarrhea, fever, and abdominal cramps. Now, in severe cases, the infection can spread to the bloodstream and lead to life-threatening complications such as septic shock or meningitis. Giardiasis is a diarrheal disease caused by the parasite known as Giardia lamblia. It's typically contracted through ingesting contaminated water or food or through direct contact with an infected person. Giardiasis can cause symptoms such as diarrhea, abdominal pain, nausea, and weight loss. In severe cases, giardiasis can lead to malnutrition and dehydration, particularly in young children and individuals with a weakened immune system. C. diff, Clostridium difficile infection. So this is a type of bacteria that can cause severe life-threatening diarrhea. It often occurs in people who've taken antibiotics, which can disrupt the balance of healthy gut bacteria and allow the bad bacteria, one of which is C. difficile, to proliferate. So symptoms of Clostridium difficile infection include watery diarrhea, abdominal pain, fever, and loss of appetite. Now, in severe cases, it can lead to a toxic megacolon, where essentially the colon is very enlarged, and that can cause bowel perforation, where there's a hole or a tear in the bowel, and both of these conditions can be life-threatening. Dysentery is an inflammatory condition of the intestines that can cause severe diarrhea, often accompanied by blood and mucus in the stool. It's typically caused by bacteria such as Shigella, or less commonly by parasites like Entamoeba histolytica. Dysentery to severe dehydration and electrolyte imbalances, and in severe cases, it can cause complications like septicemia or liver abscesses. Inflammatory bowel disease, or IBD, which includes Crohn's disease and ulcerative colitis, is a group of chronic inflammatory conditions that affect the gastrointestinal tract. Now, both of these conditions can cause persistent diarrhea, often accompanied by abdominal pain, blood in the stool, and weight loss. Untreated IBD, whether it's ulcerative colitis or Crohn's disease, can lead to serious complications such as bowel obstruction, bowel perforation, or an increased risk of colon cancer. Now, proper medical treatment and management are essential to control the symptoms and to prevent complications. So what about severe food allergies? So this isn't an infection or chronic condition like the other ones I mentioned, but severe food allergies can result in frightening and dangerous symptoms nonetheless, and this includes abdominal pain and, yes, diarrhea. An allergic reaction occurs when the immune system overreacts to a harmless substance, such as a particular food protein. So in addition to diarrhea and the abdominal pain, sometimes the symptoms might include things like hives, swelling of the face or the lips, difficulty breathing when the throat closes up, you get anaphylaxis, and this is a life-threatening allergic reaction that requires immediate medical attention. Colorectal cancer, which includes cancers of the colon and or the rectum, is one of the most common types of cancer worldwide. Now, in its early stages, it may not cause any symptoms, but as the cancer progresses, It can cause diarrhea, along with blood in the stool or a change in consistency of the stool, abdominal pain, and unexplained weight loss. So early detection and treatment is crucial for improving the chances of a successful outcome. Pancreatic cancer is a particularly aggressive form of cancer that often goes undetected until it's in its advanced stages. So the pancreas is responsible for producing digestive enzymes and hormones that regulate blood sugar levels. That's at least part of the pancreas's job. So pancreatic cancer can impair the production of these enzymes, leading to malabsorption of nutrients, and it can cause diarrhea. Another symptom that typically goes along with pancreatic cancer is jaundice. Usually it's a painless jaundice, but sometimes there can be upper abdominal pain and, of course, unexplained weight loss. Due to its late detection and aggressive nature, pancreatic cancer often has a very poor prognosis. All right, so although diarrhea is a common and usually a very self-limiting benign condition, it's crucial to be aware of the more serious and potentially life-threatening causes. So understanding these causes can help you recognize when medical attention is necessary and ensure that you receive a proper evaluation and treatment. Some concerning symptoms that are associated with diarrhea that may indicate that there's something more serious going on would include things like severe or persistent diarrhea. So diarrhea that lasts more than 2 days in adults or 24 hours in children can lead to dehydration and other complications. A high fever accompanying the diarrhea may indicate a bacterial or viral infection or another serious health condition. What about bloody or black stools? So blood in the stool can be a sign of bacterial or parasitic infections, could be a sign of gastrointestinal bleeding from higher up, whether that's in the stomach or the intestine or the colon. But it's definitely concerning when it's part of the picture of colon cancer when you combine that with weight loss. Intense abdominal pain, cramping, or discomfort may signal a more serious underlying problem, whether that be an infection or an intestinal or colonic obstruction, where there's a blockage there, or inflammation of the colon. Unintended weight loss is a big one. So when you combine that with diarrhea, that could be a sign of cancer, but also could be a sign of malabsorption or chronic infection. Persistent vomiting along with diarrhea increases the risk of dehydration and may indicate a more severe infection or another underlying problem. So signs of dehydration include excessive thirst, dry mouth, sunken eyes, dark urine, infrequent urination, dizziness, and fatigue. Dehydration can be particularly dangerous for young children and older adults. Persistent weakness, fatigue, or confusion that accompanies the diarrhea could be a sign of dehydration or electrolyte imbalance or infection.